Morning, everyone. It's been a couple of weeks since I've been able to join you, so glad to be back with the group. We'll go ahead and get started and try and talk about a couple of things that may help us predict what's going to happen in the next few months and give us a little more insight into the behavior of SARS-CoV-2 in populations. So I'm going to talk specifically about data out of the UK from their REACT study, which has been an ongoing and amazingly helpful study in providing insight into COVID-19 in the population and how that potentially again gives us a heads up about what to expect. So this was prompted by recent publication in the journal Science of the last round 19 of the REACT-1 study, which helped to highlight the combined effects of BA1 and BA2 in the UK. And for those of you who've not heard me talk about the REACT study, just a brief description. This is a study that's been run out of Imperial College in London and with collaboration of a number of different participants in the UK that looks at background population infection rates and occasionally symptoms and disease characteristics in randomly sampled populations, but very large random sampled populations across Great Britain, and gives the best insight into the true incidence of disease. So again, 19 rounds of this study that were done. Round 19 was in March of this year and looked at BA2, and you can see almost 700,000 individuals were randomly selected to be participants. Over 100,000 responded, which is amazingly good response rate for a study like this. And these participants get a throat and nasal swab kit that they then self-administer or administer to their children and return for PCR. So this study is open to and recruits people from age 5 up. And so you don't get very little kids in this, but you get school-age children. And what this looked at specifically is, again, the BA2 wave, and provided some contrast with the BA1 wave, or the initial Omicron wave. And then historically went back and looked at the previous rounds of the REACT study, which was also really interesting. So if you look at the weighted prevalence, which is essentially based on that randomized sample providing PCR samples, it gives you the best indication of how many people in the population are truly infected at any given time, because it doesn't have the selection bias that is inherent in people who go seek testing. Obviously, there's a bit of bias in who responds to the call for participants, but that seems to be quite a bit less inherently biased against people who may not take the pandemic seriously and present themselves for testing, or have other reasons for not wanting to be tested. And so gives a more realistic, I think, background rate, but it also, because it's randomized sampling over 19 rounds, gives you good comparison between the different rounds, because there should not be any difference in that type of biasing or significantly between the different rounds. And so what you see is the background prevalence in the population over each epidemic wave. And that round 8 that's circled there with a prevalence of about 1.6% is what we saw around the peak of the alpha wave. Remember, the Brits, like Europeans, do their dates backwards. So that is the 6th of January to the 22nd of January in 2021, when that first to last sample period occurred. And you can see at the peak of the alpha wave, which was at the time the largest wave that the UK had experienced, they had the highest prevalence rate that they had seen to that date, which is about 1.6%. They repeated that at around the peak of the Delta wave which was in October and November of 2021. That was 1.6%. And then you can see the dramatic increase in background prevalence that occurred with the Omicron wave, or BA1, the first Omicron wave that happened in December and January. And you can see they got it at about the peak in January, where they went up to a background prevalence of 4.4%. So that's essentially at any given time during that period of time, 4.4% of the population of Great Britain was shedding detectable virus. That's pretty astounding, right? And well above what the reported numbers were, even though the reported numbers were quite high. So it shows you that our case ascertainment is, in the UK, was still relatively poor, and even worse so in the US. And then in BA2, the most recent wave, which was in March, again, March 8th to March 31st, you can see that the highest recorded background prevalence that they had yet seen, which is 6.4%. So again, 6.4% of the population of the UK in March of this year was actively shedding detectable virus. That's amazing. Now, if you look at these different rounds, so this looked at the last 4 rounds grouped by age, you can see a couple of things. First of all, hopefully not to your surprise by this point, after hearing me talk for 2.5 years, school-age children have the highest prevalence of shedding of virus of any segment of the population, particularly young school-age children. So primary school age 5 to 11. And this is obviously, or I think, in large part explained by the fact that we're sticking kids in schools together and putting them in classrooms of 20 and 30 in small, poorly ventilated boxes. And of course, they are spreading respiratory viruses to each other. The other thing to note in the UK is that kids 5 to 11 did not yet receive vaccine by the round 19. Only recently did the UK start to vaccinate primary school age children. Now, the other thing to look at is older school age children, age 12 to 17, and then kids in college age. You can see early on in the late Delta phase and in the early BA1 or the early Omicron phase, these populations had higher proportions than others, although not nearly as pronounced as age 5 to 11. Now, this may be in part explained by the fact that the UK just started vaccinating kids 12 to 15 late in the fall. So if you go backwards, when late Delta occurred, that was in November into December, when many of those kids had received a first dose, but because the UK was spacing 3 months between first and second dose, they had not received a second dose yet. And even at the early BA1 or early Omicron phase, many kids in that age group had not yet received a second dose of vaccine. But you can see that that continues a bit by the late Omicron phase, although other age groups are catching up. And then by the BA2 wave, those older demographics now surpass that age group of adolescents and young adults in prevalence of shedding. Now, I think this is due to that vaccine phenomenon that I talked about, also due to the fact that, as I've mentioned, school-age kids tend to be the leading wave in epidemics in communities, and these kids had already been infected more than others with Delta early on. And this is backed up by the report that came out from round 15. So again, if you look at school-age children for round 14 and 15, and this was at kind of the long, prolonged plateau of Delta. If you remember back in the fall of last year, you can see that both young and older school-age children had by far much higher prevalence than the rest of the population. Again, just showing that these kids were driving transmission not only during the Delta wave, but during Omicron BA1 and during Omicron BA2. And the fact is that, almost all of the kids age 12 and above were infected with one of those viruses and vaccinated during that period of time. So that's probably a good explanation of why during the BA2 wave, that older age group of 12 and above had a lower prevalence. Just going back there, you can see again that BA2 wave, they have a lower prevalence of shedding of virus or active infection than many other age groups. But again, that age 5 to 11 group does not benefit from vaccine yet, and thus has the highest prevalence of BA2 of any other population. So, why do I talk about the UK so much? And it's because the UK tends to be a good harbinger of what's coming in the US and has been throughout the pandemic. If you look at the fall of 2020 wave, which was kind of that D614G variant of Wuhan virus that was predominant at the time. You can see it was about an 8-week lag between the UK's initial peak of D614G and the US peak. And then the US is in that kind of shadowed subtle curve just to make the difference between the two countries a little more obvious. So you can see it was about an 8-week difference between when the UK peaked and when the US peaked. With Alpha, the UK had a very large Alpha wave. The US, because Alpha occurred later in the spring, had a much more subdued wave, but you can see it was about 12 weeks difference between when the UK's peak happened and when the US peak happened. With Delta in the fall in the fall of this year, it was about a 6-week difference between the UK's peak and the US peak. With BA1 Omicron, it was much quicker to follow on, and that may have been just because spread from South Africa occurred simultaneously to the US and the UK, but the UK trailed only by about 2 weeks, you can see there. And then for BA2, the UK peaked about 11 weeks ago. 12 weeks ago. It's unclear whether that kind of little spike on the 6th of June represented the peak of BA2 for us in the US, or whether that's just kind of part of a more prolonged plateau. But you can see again, it's at least 11 weeks difference. And now the UK is starting their BA4 and 5 wave. As many of you may have noticed, the UK's had a dramatic increase in prevalence of infection, and the REACT-2 study is reflecting that as well. Their levels of community infection are actually higher than they were with Alpha or Delta even now, and that reflects the rise of BA4-5. So that for us means that we're heading into the summer already at a very high rate of infection with BA2 and with BA4-5 on the rise, and potentially the prospect of more infection. So again, looking at deaths, it's not just cases where the UK has kind of predicted what will happen in the US, but also with deaths. But the interesting difference between the US and the UK is after vaccinations began, and especially into the summer and fall of 2021, we see kind of a flip where the UK had proportionally much higher rates of death compared to the US. But after vaccines rolled out, because of the higher rates of vaccination in the UK compared to the US, you can see that the UK experienced much lower rates of deaths comparatively than the US did with the Delta wave, the Omicron wave, and we'll see what happens with the BA2 wave. The UK had actually a pretty significant BA2 wave, even in terms of deaths and hospitalizations. It's unclear whether we just haven't trended up yet, or maybe that's going to be different, but obviously, the general trend over the last year has been UK does much better in terms of hospitalizations and deaths because of their higher rates of vaccination, and especially their much higher rate of boosting. As you can see here, almost 60% of the UK population has had some booster dose, at least their third dose, versus the US, where we're only at 35%. So again, this portends potentially a pretty ugly summer and especially fall coming here in the US. And that's because we are going to have higher community rates of transmission. We're already having high rates of transmission now. And if you look at historically what's happened, the fall has been kind of the leading edge of a large wave over the last 2 years. Last year, you can see our Delta wave in September and October was quite significant and led to significant numbers of hospitalizations and deaths in the US. Now, comparatively, going into the fall of 2021, our population had actually higher rates of immunity from vaccine than we do now. So on September 1st of 2021, you can look based on these numbers here, about 45% of Americans had a vaccine dose within the last 6 months. And again, I've gone over data previously that shows time from last dose of vaccination, particularly if you're looking at boosters, really is the best indicator among a population of how protected they are. So again, in September 1st of 2021, about 45% of Americans had had a dose of vaccine within the last 6 months, about 55% within the last 8 months. Now, if you look at what the stats look like going into the fall of 2022, September of 2022, it's a very different story. So over the last 3 months, since the beginning of March, about 1.3% of Americans finished their primary series, right? So we're almost, hardly vaccinating anybody new who hasn't been vaccinated before. But let's assume that trend continues at the same pace. Then over the next 3 months until September 1st, generously, I think we could assume that about 3% of the population will have completed a primary series within the past 6 months. So that counts as having their last dose of vaccine within the last 6 months. And if you look at our rate of boosting, over the last 3 months since the beginning of March, about 7% of Americans received a booster dose since March 1st. So we'll assume that trend continues at the same pace, and thus by September 1st, within the last 6 months, about 15% will have received a booster dose in the last 6 months. And then obviously the other population that's going to get vaccinated newly starting this month, hopefully, are kids under the age of 5, which overall represents 6% of the US population. Now let's assume that there's a 33% uptake among those kids, which is around what we had in age 5 to 12. I think honestly that's probably optimistic, but we'll be optimists and say that means an additional 2% of the American population under the age of 5 will have received a dose. Obviously, that's even more optimistic because we're not vaccinating kids under 6 months, but we'll ignore that. So that essentially means, based on our current trends, about 20% of the US population will have received a vaccine dose within the last 6 months on September 1st. Now, remember, September 1st of 2021, it was 45%. So we're going into the fall of 2022 with less than half of the vaccine in the last 6 months population than we did last year. That is not going to put us in a good position to be able to limit transmission, hospitalization, and death, unfortunately. So that's what we're looking at. It is not going to be pretty. And again, we're dealing with viruses that you can clearly see from the UK data that are much more transmissible and spreading much more broadly in the population than they were previously. Now, also in that UK data, there may be some factor of the fact that BA2 appears to shed a bit longer in people. And so that will increase that background prevalence rate as well, but not to the degree that we're seeing there. 5 to 6 times the background prevalence of previous variants is pretty hard to argue against. So that is my depressing prediction for summer and fall.
Well, unfortunately, James, you haven't been very far off.